Hello, I'm Josh Johnston from Atlanta, Georgia, and I practice at Georgia Eye Partners there. We were excited to be here and delivered a great presentation, and some of the key pearls we focused on was really the X's and O's of co-management, how to be more involved with cataract co-management with surgeons in your community, and what you need to take home, some tangible benefits of how to do this and how to improve if you're doing it already. So some of the key pearls we talked about were pearls, with co-management. One thing that was very important we discussed was get to know your surgeon. Getting to know your surgeon is very important. Would you send your mom there? Would you send your dad there? Would you get your own eye surgery there? It's good to always kind of go to these surgery centers, look at them, look at the surgeons. Are these people you know and trust and feel like they're good quality surgeons? Conveying patient preferences is key. So you are the primary eye care doctor for these patients. You know these patients better than the surgeons do oftentimes. You need to give those preferences to the surgeon ahead of time, whether that's a verbal discussion or through a letter and communication like that, to really talk about the patient preference and the goal of the surgery. Distance vision only, does that patient want near vision and distance vision? What are those patient personality profiles like that can help guide your surgeon on that, maybe that implant selection down the road? During this process, you want to inform your patients on your role in perioperative care. You really are the eye care provider, the primary eye care doctor. You need to diagnose these patients with cataracts. Once that diagnosis occurs, you then educate the patient, start them down that journey, informing them about astigmatism, their visual goals. Do they want to see good far away and up close? There are many technology options that are out there. It's our role to really start discussing that with your patients and teeing them up for that surgical decision they'll make down the road. Successful co-management really is the result of continuous communication. It starts with you and the patient. That dialogue then carries on with the patient and the surgeon, and then the surgeon back to you, the co-managing optometrist, and then ending with you working with your patient on the back end when you're finishing communication and post-op care of that patient. So these are some of the simple tips that are involved in co-management that can make it better and have higher success rates and better outcomes with your patients. Some of the 5 key pearls we discussed that we focused on, doing a lot of co-management in monofocals as well as presbyopic and other advanced technology IOLs. I think these are the most impactful and things that can help ODs the most day to day. The first being plano outcome, what we discussed there. If you have residual refractive error, that can lead to decreased outcomes, inducing more glare and halos and limiting the visual outcome. So if it's there, you need to proactively plan to treat that down the road. Fortunately, technology is really good and we get less residual refractive errors these days. Proactive treatment of ocular surface disease is really important. Doing that preoperatively will help you have better outcomes, happier patients, and then less refractive error misses, if you will, and less residual refractive error. Pre-op counseling is something we can do less and less of these days. The IOLs are sort of more forgiving with less glare and halos, but you want to screen these patients and give them realistic expectations up front on how these lenses work and sometimes how they may have some pitfalls there a little bit. And not everybody's a candidate for every IOL, so you want to properly screen candidates and then certainly look for the right IOL. Do patients desire distance, intermediate, distance and intermediate, only near sometimes? So there's many options. You need to find the visual goal prior to surgery so these patients are happy. Briefly touched on a few other pearls as well. Again, picking the right surgeon is very important. How posterior capsular opacification can be viewed as a complication by patients, and you want to watch that especially in multifocal patients. And then centration. Fortunately, that is not a big issue with the good technology we have with our toric IOLs today. And then finally, we finished up with sort of a review of what's new. This was sort of a review of the advanced technology IOLs that are out there in the market today. We've had some of these for many years now. Multifocals, they work well, giving patients good distance, intermediate and near vision. We have a whole new category with the extended range of vision IOLs, the EDOF, extended depth of focus with the Technis Symphony, which is really giving good results as far as good distance, intermediate, and certainly less forgiving with less glare and halos, similar to a monofocal. So some patients who couldn't tolerate a multifocal for those reasons, Technis Symphony has been a great advantage. And then of course this week, the FDA approval of the new Microsoft IQ Toric multifocal. So again, giving patients good multifocality, good distance, intermediate, near, with even treating astigmatism at the same time. The new multifocals these days with the low rad powers are again more forgiving, less chair time, and patients have less incidence of glare and halos, and certainly leading to better outcomes and happier patients. As you can see, there are a lot of options today. Fortunately, these are safe, good outcomes patients are excited about. It's a good time to be a patient with a cataract when you get that diagnosis, because we have so much technology that's very good about giving good vision for these patients. And it's also a good time to be an optometrist. We can really help our patients by first diagnosing a cataract, and then second, talking about the technology that's available, educating our patients about the options they have, starting that discussion. That way when they get this process and end up getting surgery, they're well aware of all the advanced technology that's available, and then they certainly get the best outcome possible.